Our case report was entitled Elbow Interpositional Arthroplasty Using an Achilles Tendon Allograft, a case report, and this study was out of the Ohio Health Department of Orthopedic Surgery. The treatment of post-traumatic elbow arthritis poses a significant challenge for orthopedic surgeons, especially in the young, healthy, active patient population. And you often hear about total elbow arthroplasty. That's often recommended treatment option in older patients, but this does have high complication rates, and after the procedure, the patients are unable to lift 5 pounds with this implant. However, interpositional arthroplasty remains a viable option in high-demand patients and is an alternative salvage procedure for patients with post-traumatic elbow arthritis. Commonly, the fascia lata and Achilles tendons are used and placed within the elbow joint itself to avoid the rough, bony surfaces from rubbing together. This helps maintain the joint space and can help preserve some motion in the elbow joint itself. Therefore, the objective of this study was to describe a case of a patient who successfully underwent an elbow interpositional arthroplasty with an Achilles tendon graft who had no functional limitations after the surgery. And again, we describe a case that shows that this surgical technique is a viable option for managing patients with post-traumatic elbow arthritis. Our patient was a 50-year-old male. He had multiple previous surgeries and multiple injuries and developed significant pain after this, as well as functional limitations to the elbow, specifically with flexion extension, as well as having some issues pronating and supinating. His x-rays and CTs were acquired, which demonstrated significant post-traumatic arthritis of the elbow, which you can see on the right-hand side. Therefore, we believe that this patient was an excellent candidate for elbow interpositional arthroplasty instead of a total elbow arthroplasty. So for the surgical approach, we use the lateral paraolecranon approach and came in from that posterior lateral aspect. Initially, we encountered the MCL and LCL from their proximal attachments on the distal humerus, and these were subsequently reflected to get better visualization of the elbow joint. We also did an extensive capsular release posteriorly, again to better expose the elbow joint for a procedure. The elbow was then subsequently dislocated. The Achilles graft that we had used was prepared and inserted using a number 2 fiber wire for added stability. After this graft was inserted, we went ahead and repaired the MCL and LCL back on their distal humerus attachments. We then assessed range of motion intraoperatively. So the patient had a significant increase in flexion as well as extension, so reached terminal flexion at 140 degrees and was about 15 degrees short of full extension of the elbow. We also assessed the overall stability of the elbow, which was good. Again, he had significant improvement in his range of motion. We also did a transposition of his ulnar nerve. After the procedure, the patient was posed in a posterior slab splint until his follow-up approximately 2 weeks after surgery. He was then transitioned into an unlocked hinged elbow brace. And at this time, we got a VAS pain score. So this is a visual analog score, a Mayo elbow performing score, American shoulder and elbow score, and disability of the arm, shoulder, and hand. And all of these scores were significantly improved compared to his preoperative values, and he's doing great today. Overall, the literature is very favorable in these younger patients treated with an interpositional arthroplasty, with the most common complication being revision, which is recorded in up to 20% of patients. And the biggest difference from the literature and our case report is that we used a hinged elbow brace postoperatively for stability, and our patient did very well and had significant improvement with range of motion. So overall, this procedure is a great salvage procedure with great outcomes in our patient using this hinged elbow brace postoperatively, and he is back to his everyday activities.